You might have seen some headlines recently looking at a study that examined the risk of diabetes in kids after a COVID-19 infection. As we like to say on this segment, we're going to separate the facts from the fear and the fiction when it comes to this. So today we're joined by Dr. Jane Lynch, a pediatric endocrinologist at UT Health San Antonio. Dr. Lynch, thank you for being here. Let's first start with this study. What did it look at? What did it find?
So it's actually two studies that came out of U.S. data. We've been following this literature in Asia and in Europe, and we've been suspicious this was the case. These two very, very large database studies that we're looking at, in the first one, children, the incidence rate of diabetes in the past year, past time of the pandemic compared to the past, and compared to children with and without COVID. And the second study was looking specifically at kids who've had COVID and the rate of onset of new onset diabetes. So both of these had incredibly similar outcomes of what they found of close to doubling in the first one of the larger study of risk for developing diabetes after having had COVID, after all the symptoms settled down, at least a month later. And we are worried because we have seen the same thing. Typically 3 to 5 months after COVID, we're having these children come into us, often through the emergency room, pretty sick with new onset diabetes.
Talk about what this means for San Antonio. I mean, obviously, we already have a high rate of diabetes. Are we also seeing what they're seeing in the study that comes from the CDC?
We are. We've been tracking, and we actually have had a crew of volunteer staff putting together our database looking at new onset. And it's both type 1 and type 2 here. It's at least a tripling of our rates in San Antonio. The kids are quite ill. Most end up in the ICU with the new onset ketones and high blood sugar. Is it common to have diabetes? No. I mean, it's still, the odds are slim of your child developing diabetes after COVID, but they're probably 2 to 3 times higher than they were before COVID, several months later. So unfortunately, it often is missed early on because it looks a lot like flu, and people are having a hard time getting in to see their primary care doctors. So we really want to get the word out. It's data that mimics what was being seen in adults. However, in children, it's both type 1 and type 2, probably for different mechanisms.
We've talked on this very segment about how family history plays a big role in diabetes. We have such a prevalent rate of that in our own community. So for kids who already have diabetes, who get COVID-19, are they at increased risk of serious symptoms?
Yes, and so that's not what we've seen other literature coming out, and that's been our experience as well, is that if you have diabetes, either type 1, which is insulin-dependent juvenile diabetes, or type 2, more insulin-resistant, inherited form of diabetes, both of those, when you become ill, COVID in particular makes your blood sugar shoot up. And we know that from adults. We have probably the pager's gone off nonstop for the last few months of our poor families with kids with diabetes whose children are positive for COVID, really struggling to control the blood sugars, needing extra insulin, and sometimes needing to come into the hospital.
Does this mean that all kids have a higher risk of diabetes after getting COVID, or just kids with certain conditions?
We don't know that yet, but we hope to figure that out. One of the problems with this study that they reported is they can't tell the difference for what was type 1, what was type 2. And what's interesting to me is that in this timeline, none of the kids would have been vaccinated under age 18. So that'll be interesting to see too. COVID attacks the beta cells directly in one way. It also causes massive inflammation in another way. So I would expect that this is mostly kids that are either predisposed, they have family histories of type 1 diabetes, thyroid disease, autoimmune diseases, or they have families with high rates of type 2 diabetes. And both those kids I would consider to be high risk categories.
Before we go here, let's let people know what are the signs to watch out for. If they're concerned that their kids may have developed diabetes, what should they be looking for?
So often, if they're in a family with type 2 diabetes, someone in the house probably has a blood sugar meter to check the blood sugar. But the symptoms of a high blood sugar are trying to flush that sugar out of your system. So you're urinating the sugar out in urine and you're going to the bathroom more, and then thirsty because you're urinating so much water, headache, fatigue, you develop some acids that give you stomach aches and vomiting. Problem is, it often looks like the flu. And a lot of our kids have been on telemed visits or urgent care visits and sent home as flu when nobody checked their blood sugar.
Dr. Jane Lynch with UT Health San Antonio, a pediatric endocrinologist. Thank you so much for your time. I also want to, just to repeat again, you are seeing a tripling of the new rate of new onset cases in San Antonio. That's something right there that, we better start paying attention to.
Mm-hmm.
Yeah, and it's both type 1 and type 2 in families that have those risk factors. So we don't know. We would expect vaccination would reduce the inflammation and risk for this, but we really are going to be following this for data. And we're highly recommending that for all of our families who have family members with diabetes.
Dr. Lynch, thank you for being here. We appreciate the information.
Oh, thanks for the opportunity. Have a nice night.
You too.
You too.